Hello, my name is Kassie, and these are my partners, Allison and Emily. We are group 4, and our topic for this literature review was vision, and specifically binocular vision in regards to reading. Our OT we worked with throughout the semester was Crystal McKelvey, and this project was completed to fulfill the requirement of OCTH 540 Research Methods 1 at Eastern Michigan University. Our research question was, what is the role of occupational therapy with children who have binocular vision dysfunction in regards to reading? Some background information is binocular vision dysfunction, also known as BVD, is where two eyes have difficulty working together as a team, resulting in a vertical or horizontal, or both, misalignment between the eyesight of one eye to the other eye. BVD causes excess stress on eye muscles, often resulting in headaches, dizziness, and difficulty reading. The purpose of this research was to identify the role of OT within children ages 4 to 12 with oculomotor and/or BVD in regards to reading. Optometrists and occupational therapists are two professions that play an important role in assessing or treating children with BVD. The line between an OT's role and an optometrist's role is difficult to distinguish. The role in OT working with children with BVD appears to be unclear. There is a lack of evidence understanding which interventions are best suitable with children with BVD. And lastly, the research findings are significant because they provide the most up-to-date information on the best interventions to use with children with BVD and synthesize all the previous data into one concise document.
For the methods of our review, we used 8 peer-reviewed articles ranging from year 2006 to 2021 to help examine and support the research question. We explored a variety of databases such as ARIC, CINAHL, the American Journal of Occupational Therapy, Journal of Optometry, OTDBase, OTSeeker, eSearch, PubMed, and the Web of Science. We concluded our search with key terms such as binocular vision, occupational therapy, reading, convergence insufficiency, and oculomotor. A research strategy that we used was site referencing. We used the references of articles to help find other articles for our question. Our inclusion criteria included focusing solely on articles that explored binocular vision in children. And our exclusion criteria was any articles that talked about vision after experiencing a TBI or articles with adults with vision deficits.
For our results, we didn't find an exact answer to our question just because it was very specific and there was a limited amount of previous research. However, we did find some information that could be useful. We saw a common theme throughout many of the articles that computer-based interventions and office-based vision therapy improved binocular vision dysfunction. We couldn't find a distinct role between OTs and optometrists. There are several overlaps in the professions. We also found that occupational therapists can play a part in assessing for BVD and collaborate with optometrists to provide the best possible care for their clients. Something else we found useful for OTs were 5 concepts used in vision therapy that helped improve functional binocular vision. These were fast focusing, smooth tracking, jump tracking, cross-eyed fusion, and wall-eyed fusion.
And for clinical implications, as Allison mentioned in the findings of results, vision therapy administered by optometrists proved to be the most effective treatment in children with BVD. And I know that's not necessarily the expertise of occupational therapists, but we can work to adopt those concepts and incorporate them into our interventions to help work alongside of optometrists, just help optimize treatment results. And those specific eye movements from vision therapy that Allison touched on, fast focusing, smooth tracking, jump tracking, cross-eyed fusion, and wall-eyed fusion, they could all be applied to OT interventions with examples such as having a child reach for toothpicks in a container across the table and putting them into a container closer to them to work on convergence and divergence skills, or having a child play a game like air hockey that would require the child to use skills like fast focusing and jump tracking of the puck across the table.
For future research, more specific research should be done, most likely with OTs who work with children who have BVD.
In regards to limitations, most of the articles we found had a small sample size. So for instance, one of our articles only had 3 participants and another article only had 1 participant. The small sample sizes of these articles make it difficult to generalize the results to a larger population and is considered a low power result. We had 2 articles contradict each other throughout our research in regards to the computer-based program. The articles that were reviewed did not allow a definitive answer to our research question. And lastly, there is still a lot of research needed to be done before there is an answer to exactly where the line is between VT, which is vision therapy, and OT in regards to vision. So there is a QR code at the bottom of our references to scan in case you're looking for more information. But that concludes our poster presentation on our research project pertaining to binocular vision. So thank you for listening.